Hi friends, welcome back to BGS Clinics. In this clinical class, I will discuss palpation of lymph nodes in the groin. It is essential to acquire this clinical skill as we frequently require to palpate these lymph nodes in addition to those in the neck and axilla on which I have made separate videos. You may recall what I said at the outset in the video on local examination. Local examination is never complete without examination of the surrounding area and regional lymph nodes. Basically, two inguinal groups of lymph nodes and one femoral lymph node constitute the groin lymph nodes. The inguinal groups of nodes are superficial and deep. Lymphatic vessels accompanying the long saphenous vein from the foot, leg and thigh, and numerous other lymphatics spiraling around the outer side of the thigh converge on the superficial inguinal nodes. They are called superficial because they lie in the subcutaneous fat of the femoral triangle. Femoral triangle is bounded by inguinal ligament, the medial border of sartorius, and the medial border of adductor longus. So, nodes of this group lie below. By that I mean distal to the inguinal ligament. These are up to 20 nodes arranged in an irregular T-shaped pattern. The longitudinal group of nodes lies along the long limb of T. The outer side of the transverse limb of T is the lateral group and the inner side is the medial group of nodes. The longitudinal group of nodes lies lateral to the termination of long saphenous vein. It receives lymphatics from all the superficial tissue of the lower limb. The lateral group receives lymph from buttock, flank and back below the level of the umbilicus. The medial group receives lymph from anterior abdominal wall below the level of the umbilicus and also from the perineum. Perineum includes the lower part of the anal canal, urethra and external genitalia of both sexes. The efferent lymphatics from all these three groups converge towards the saphenous opening and pass through the cribriform fascia to enter 3 or 4 deep inguinal nodes. The deep inguinal nodes lie deep to deep fascia medial to femoral vein. In addition to inguinal nodes, a lymph node lies in the femoral canal. It is said to drain the lymph directly from glans clitoris or glans penis. Abduct the thigh slightly to open out the groin and then palpate the nodes using the same technique, that is, with gentle rotating movements of the pulp of the fingertips. Thanks for watching.